Hello everyone, it's Dr. Dave. Hope you're all doing well, enjoying the middle of your week, and you're staying healthy, sharing some smiles out there with each other. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update. It's Wednesday, January 20th, 2021. Go look at 6 areas of health and wellness today. Somewhere around this video, you can read all 6 areas. We'll touch on maybe each one of them. I always want to just do a few, but I end up doing all of them, so we'll probably do the same again today, if that's all right. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, when you tune in, tap into, plug into, and embrace the opportunity to get some factual health and wellness information on a daily basis, it will support your own thoughts, actions, and decisions with your own health and wellness, and hopefully keep steering you in the right direction to have those great experiences you want to have every day in your life, because you do live your life through your body, and the healthier it is, you're just going to have more fun. All right. If you'd like a copy of this daily health update hard copy, you can DM us on social, call the clinic, or send us an email, and we will make sure that you get one. All right. Sleep apnea. A bit of a challenge. People stop breathing at night. For their partners, it can be a little bit scary, but can be unhealthy for the person who has sleep apnea. And now they're finding through the Journal of Clinical Sleep Medicine, January 2021, that it can also impair spatial navigation skills. They looked at a group of 52 older adults, 22 with untreated obstructive sleep apnea, and they observed that participants performed worse on spatial navigation tests early in the day if they had obstructive sleep apnea. So be cautious navigating. I don't know if that's just with your own body or using some kind of machinery like a vehicle, but that's something that you want to be cautious of. And if you or especially someone has told you that you may stop breathing at night, you do want to seek out some help with that, because it can impact your health in apparently many different ways, many interesting ways perhaps. Clinical Nutrition Journal, December 2020, says that dietary choices may protect against dementia. And basically, they looked at over 3,000 older adults, and they said you want to keep that fish, seafood, and plant-based foods in your diet while decreasing animal proteins, added sugars, and fat. And that could have about a 38%, give or take, apparently, difference in developing cognitive decline. So healthy diet, lots of benefits to that as well. Also for seniors, if they're fit, they may be more likely to be happy, but less likely to have depression. The International Journal of Environmental Research and Public Health in January 2021 talked about the Korean longitudinal study of aging, and they found that those who regularly exercise versus those who don't may be up to 18% more likely to experience the symptoms of depression. Exercise is good for your heart, good for your lungs, good for your brain, good for your mood. So get out there and get that body moving today. Hearing loss, according to the Neuropsychology Development and Cognition Journal, December 2020, can affect your cognitive function. The results of a 6-year study involving over 1,000 adults suggest that seniors who develop moderate to severe hearing difficulties are at increased risk for cognitive decline, particularly in the domains of attention and processing speed, visual spatial ability. So keep an eye on your ability to hear well, and know that if that starts to change, it may be a sign that other things are also on the decline, unfortunately. And the idea is to get some early intervention always, but of course, with our lifestyle, we want to engage in habits that support good hearing and our good overall health to avoid these problems if we can. The Vanderbilt University Medical Center, December 2020, came out with some home heating hazards you'd want to be aware of. There are some accidents that relate to home heating, and they say to follow the following tips to avoid that. You want to install carbon monoxide alarms near your sleeping areas, have your furnaces, boilers, and fireplaces checked by professionals every year. Never use a kitchen stove or grill to heat your home, and keep electrical space heaters at least 3 feet from flammable items, and use grounded cords on major electrical appliances, and inspect those cords for damage, and never run electrical cords under carpets. All very good advice to keep us safe in our homes, especially this winter while we're trying to stay warm. Finally, on the chiropractic side of things, the BMC Musculoskeletal Disorders Journal, January 2021, says that musculoskeletal pain in the muscles, bones, and joints of the body may affect future dentists. Questionnaires completed by over 200 dental students revealed that 48.5% of them already had musculoskeletal pain at least one body site in the last week, and 68.3% had pain in at least one area within the last year. Further analysis identified the following risk factors for musculoskeletal pain in those future dentists: history of trauma, lack of exercise, longer clinical sessions, and being overweight. So probably not just dentists, but the majority of us in whatever it is we're trying to do every day would benefit from trying to keep some exercise in our life, keep our activities that stress us low, and take breaks from those things that we do have to do so we don't get stressed, and of course try to maintain as close to an ideal body weight as we possibly can as we're enjoying this journey through life. Not always an easy task, but it is possible, and you'll be glad that you did, or you make the effort to get back to as close to possible, because it will serve you well. That's your daily health update for Wednesday this week. We'll be back tomorrow, Thursday, with another video for you, and then the printed version on Friday to head you into the weekend. And I hope it's going well for you. I look forward to catching up with you tomorrow. All the best to you and yours. Take care.